welcome to this session. I know it's the end of the day, end of the afternoon, where there's been really great sessions. So I'm glad you could join us for how the Great Lakes Public Health Coalition works to address racial equity in the Region 5 APHA affiliates. Just for a couple of housekeeping, the session's being recorded. We ask that you keep yourself muted unless you're speaking, and utilize the chat box for any questions or comments that you have. And next slide. So we hope that your participation today, will be able to explain, and you'll be able to learn why racial equity is health equity. You'll be able to recognize some of the work and activities we're doing in the states that are in the Great Lake region, and that you'll learn some concepts that you can apply to your work and whatever role you're in. Next slide. So I'm going to just do a brief introduction of the Great Lakes Coalition and what it is, and then we're going to hear presentations from each of the states, and then there'll be a little time for questions. Next slide. So these are the states that are in the Great Lakes Public Health Coalition. They're all states that border the Great Lakes. As you notice in this coalition, we have 2 MPHAs and 2 IPHAs in the region. Next slide. So I know you heard from the president of APHA this morning, and the Great Lakes Coalition is comprised of the affiliate representatives to the Governing Council of APHA from the 6 states in the region. APHA has about 50,000 members worldwide. There's sections, there's caucuses, there's special interest groups, and we're on the bottom right of this graph as state affiliate. Each state has a state affiliate. The Great Lakes Public Health Coalition came together in 1983. The mission is to strengthen APHA state affiliates' capacity to advance public health in the region. And our vision is for health, equity, and justice for all within the Great Lakes region. Next slide. So we meet 2 times a year, usually in person, but this year we're not in person. We have monthly conference calls. We support and leverage state initiatives. And we present each year on a panel of the annual conference for of the person who's the chair of the coalition, and I'm chair this year, and much more. This year, our focus of our work has been on health equity, anti-racism, and social justice work, and that's the topic that we're going to be presenting today. And as you know, for this region, we have some of the worst evidence of racism evidenced by Flint, and we have Chicago, and we have Minnesota in it. So each presenter is going to introduce themselves and their background and their role. And I'm now going to pass this over to Ella Green-Moton from Michigan, and she's going to give us a little bit more introduction, which is next slide.
Thanks, Erica. Hi again, everyone. As Erica shared, I'm Ella Green-Moton. I am the ARGC, or the affiliate regional rep of Governing Council to APHA representing Michigan. And this question was posed to us, why is racial equity health equity? And I have to admit, when I began to think about the question, my first thought was why or when isn't racial equity health equity? And actually just because that's the way my head works, right? But then I remembered an old cautionary rule about answering a question with a question, and decided to drill a little deeper into the question. So here are some of the things that rang out to me. Next slide, please. So in my head, I believe they interface, right? Those 2, racial and health equity. And one very vivid picture came to mind, this idea of many systems and structures in our society, and how those systems and structures influence, dictate, motivate, and drive most, if not all, of the aspects of our lives, including health. And you can see from the different structures. You know, you look at the expressways on the right, and it's a mess, right? But you look at the wording on the left that talks about the structures or the housing system, the banking and finance system, plus prejudice and racism equals redlining, and the piece on education systems and law enforcement and the judicial system, plus Wall Street, plus prejudice, plus racism equals school to prison pipeline. And the medical research and government, prejudice, racism equals Tuskegee, Flint water crisis, and COVID. So we have to think about the intersection of all of these systems and all of these structures when we think about whether we're thinking about racial equity or health equity, or if we can think about them in the same vein. Next slide, please. And just to be clear, I always like to start with an identifying definition of the words and statements that we're talking about. So for racial equity, we're talking about societal conditions in which the distribution of resources and opportunities is neither determined nor predicted by race, racial bias, or racial ideology, and where the structures, systems, and practices and cultural narratives in society provide true situational fairness and equal opportunity. Next slide, please. And when we think about health equity, we're thinking about a situation where everyone has a fair and just opportunity to be as healthy as possible. Or we're thinking about the removal of obstacles to health, such as poverty, discrimination, and deep power imbalances and their consequences, including lack of access to good jobs with fair pay, quality education and housing, safe environments, and healthcare. Next slide. And so when we think about all of that, and thinking about the earlier slide that talked about the structural systems, the structural barriers, we have to circle back and think about dismantling fundamental and historical causes of inequality. And drilling more deeply into those structures and systems and being able to understand what they are, how they came about, call them out for what they are, and how they've contributed to the actualities of equity, both racial and health, and acknowledging that as long as these structures and systems exist, our reality is there will be racial inequalities and health inequalities and inequities. Next slide, please.
So I'm going to start. Thank you, Ella, for that great presentation. And then I'm going to start by doing the first presentation on the state affiliates works related to health and racial equity. So Minnesota Public Health Association intentionally focuses on advancing health and racial equity through our work. And I'm just going to share a little bit about the journey. We know in Minnesota that there's longstanding and significant disparities in health outcomes among populations of color and American Indians. And I think Ella just laid out the importance of looking at structural racism. And that's a lot of what our work is. And other people have also discussed the other reasons why we're doing this work in Minnesota. Next slide. So we recognize that the work of health equity and addressing racism is the work of the whole organization and not just one committee. So this work is incorporated into our strategic planning and other MPHA activities and the Health Equity Committee as well. The committee was formed in 2016 to focus on taking action and support health and community-based health equity activities. We also wanted to create a safe space for conversations for people and for them to be able to gain knowledge and skills to use in their work. Next slide. So our committee meets monthly. We meet from 5:30 to 7:30 p.m. The meetings are open to both affiliate members and non-members in an effort to reach people working to improve health in ways that make sense for their communities, but who may not yet feel comfortable becoming a member of MPHA. The work that we do through this committee, we address racism through education, engagement, and policy development. The first hour is devoted to education on a topic related to health equity. And the reason that we do this is to create a shared narrative and understanding among the participants. Next slide. We know, though, that education is not enough and we have to take action. So the second half of the meeting is devoted to taking action on some topics. One of the things we did was to develop this acknowledgement of ancestral land statement. It was developed and reviewed by Anishinaabe and Dakota leaders in Minnesota. And we start every meeting with this statement. We've also made this available to other nonprofits and affiliates around the country. And we're really pleased to say that many have adapted and adopted it for their own use. Next slide. We also take part in other actions or participate in other actions as part of the Health Equity Committee. Most of this relates to policy and advocacy efforts, and it's policy with a big P and a little p. So we write letters of support on different topics related to health equity for, we've done some letters to the editor. We also wrote a letter to the governor asking him to declare racism as a public health crisis in Minnesota. We've provided actions in support of legislation. We've developed fact sheets for legislators to use and provided testimonies at hearings. One of the other things we've done as a committee is we've worked with the governor's office on developing some guidelines for state agencies to implement voter registration within their agencies and with their contractors. We work in partnership and solidarity with the community on efforts that they would like us to support for them. And we develop policy and policy statements and resolutions. Next slide. So this is our list of the policy statements that we've developed over the last couple of years. And now I think that you're probably looking at all this and say, this is all writing and it's all words. So why are we doing this and why is it important? By doing these efforts, we engage members and make use of their knowledge and skills. We develop fact sheets and information that provide scientific evidence and practice-based evidence to support public health issues. They can be used by members and other advocacy groups for policy changes in their workplaces, at the legislature or educational institutions. They are used to inform our membership, to inform decision makers and support our communities. Next slide. We also have spent some time developing some shared language in our work. And I know one of the other breakouts was talking about this. As the term BIPOC became popularized, it was brought to our attention that it's not appropriate for our organization to use, and we were asked to refrain from using the term in our communications. We also called out using American Indians, listing it separately to recognize and honor their unique sovereign relationships with other governments, and we believe it's more respectful. Next slide. So we continue to do actions within our organization too. As you know, our annual conference has been focused on anti-racism, public health, and equity. We're working on identifying, analyzing, and addressing structural racism within our organization, and also diversifying our membership and leadership. So that's the journey that we're continuing on, and I'm going to pass it over to Kelly to introduce herself and talk about their work.
Hi, everybody. My name is Kelly Bragg, and I am the ARGC for Ohio. And I'm in my other life, I am a program manager with the Center for Public Health Practice at the College of Public Health at Ohio State. So I'm going to talk a little bit about what OPHA has done relative to racial equity work. And in Ohio, our efforts really have focused on two main areas, and that's advocacy and education. So as far as our advocacy work, we got very involved with health and equity in all policies in 2015. And like I said, in 2015, we adopted that as and organizational value, and we formed a committee to address poor health outcomes and social inequities in Ohio. The project was undertaken in collaboration with State Senator Charlita Tavares, who was the keynote speaker at that year's OPHA conference. You can see we produced a sort of one pager, which is very hard to read on your screen, but it's a little more interesting to look at than the black and white words. So you can go to our website, which is opha.org, and look at this yourself. But as a sort of summary of what you're looking at there, the work included facilitated conversations with stakeholders, developing and testing an assessment tool for reviewing draft legislation and administrative rules. We engaged a research firm to develop a report on other states' efforts to advance health and equity. We implemented an internal commitment to health and equity in all policies and advocated to legislators, about the issue. And there was a bill introduced in our state Senate to make this a state policy in 2018. And while that bill did not pass, because it never got voted on, it died before it could get voted on. The issue does continue to be a priority for OPHA. This was a huge learning process for us and learning opportunities. We learned a lot from our work with this. We learned that we need to make sure that everybody is, a lot of more education than what we offered is needed on the scope and breadth of the social determinants of health and why this is an issue. We find that a lot of people that aren't so familiar with the public health language that we speak didn't really understand all of the far-reaching impacts that this can have. So more education needed, and that we just need to engage more stakeholders before we do this type of work. And then our next steps, we're engaging the entire OPHA membership in the work. We have a legislative liaison program that we're mobilizing to help advance these efforts, and just seeking more support for a bill so it can get to the point where it gets voted on. In addition, we have declared racism a public health crisis in Ohio, and we have encouraged our members to work with their communities to have that declaration locally. And then finally, one of the unique things we're doing in Ohio is we have dental equity as a focus. Dental equity is one of the biggest access to care issues that we have, and it's one of our big issues in Ohio. So we have partnered with dozens of community-based organizations and statewide advocacy organizations to work on this. This is very recent, February of 2021. So it's a new initiative that we have, but we're having some good momentum on it. So as far as education goes, we've done a lot to bring awareness to this issue. We do produce a journal. It's a peer-reviewed journal, and our December 2020 issue was dedicated to racism as a public health issue. There was an editorial about addressing racism as a public health crisis in Ohio. We had a letter, an op-ed about the disproportionate impact of COVID-19 on lower income minority populations. And then there were research briefs on perceived racial discrimination and the health of Black youth in Ohio, the benefits of understanding systemic racism informing clinician-patient relationships to reduce Black infant mortality. And then there was commentary on racism. There's a racism measurement framework. So I encourage you all, if you go to ojph.org, I believe that's the website. If not, you can go to opha.org and find it there. The issue is free and you are welcome to download it and read the articles in it. We were really proud of this issue. In addition, we produced 2 webinars in partnership with the Region 5 Public Health Training Center, focusing on racism as a public health crisis. And we, in general, or in normal times, I guess, host what we call a public policy institute. So we pick a topic and we gather people, we invite people for a one-day conference to learn about different policy issues that are happening in the state. And so for the Public Policy Institute for this year, we focused it on racism as a public health crisis, and we just did 2 webinars. So there was just an overview of racism as a public health crisis, and then we did a case study on Franklin County, which is the county that Columbus is in, and how they have done health equity and racism as a public health crisis. So both of those are available on demand. If you just want to go to the Region 5 PHTC website, you can view them on demand. We love to share them. So I am going to turn it over to Wisconsin.
Yes, thank you, Kelly. So my name's Kristen Grimes, and I am the ARGC for Wisconsin. And in my day job, I'm the Director of Prevention Services at Vivint Health, which is an AIDS service organization in Wisconsin, Texas, Colorado, and Missouri. So today, though, we're talking about racial equity in Wisconsin, and we established racism as a public health crisis resolution. We wrote that in 2018. And then in 2019, we completed our racial equity assessment. So what I want to share today is where are we now? Next slide, please. So again, the resolution was written in 2018 and approved by our board. And then in 19, we completed our internal assessment of our policies and procedures, and we hired an outside firm, and I'll show you the name of that on the next slide. But we not only looked at what are the written policies and procedures, but part of this assessment also included interviews with our leadership team and some of our members. And then a report came out of that with some recommendations that we're working to implement now. We also are working to diversify our membership and leadership, trying to make sure that not only are we being purposeful in inviting folks to the table, but making sure that it's a safe space when they get here. And that is definitely a work in progress. And then trying to incorporate educational efforts across the association. So whether it's at the leadership level or with our general membership, trying to do that in different ways. And then advocating for relevant policies. This is a topic that we dove into with our Racial Equity Committee and our Joint Public Affairs Committee. And it's a big topic. How do you quickly assess a piece of legislation that's going forward as to what are the consequences from a racial equity perspective? And how do you gain input from the people who it's going to impact the most? And so it's definitely a work in progress, but we've started the conversation. And then we're continuing to build alliances and partnerships with other organizations who are confronting racism and those addressing health inequities. Next slide, please. So, there we go. So just a quick shout out to Ubuntu. They are the firm that we hired to do our internal assessment. So again, they not only provided education with our leadership team, both the board and all of our committee and section chairs, but they did the interviews, they did some, and then they reviewed our policies and procedures, and again, gave us a wonderful report that we are utilizing now to implement. And then the folks on the right, this is some of the people that were in the founding WPHA Racial Equity Work Group who helped to write that resolution, create a website of materials, and help push this work forward. Next slide, please. So some of the things that we are implementing now is specifically in some of those therefore be it resolved. We have incorporated some of that into our strategic plan. And then in our 2020 work plan and beyond, there are racial equity goals that are expected to come from not only the board, the staff, the committees, and the sections. So we're asking everybody to incorporate this in their work and incorporate it into the work plan that we have. The racial equity work group that was kind of a short-term group of the board is now an official racial equity committee that includes both members and non-members. There's a specific line item now in our budget to address racial equity every year as to what and utilize it in different ways. So that's dependent on what needs to happen next. Our board candidates also need to address racial equity within their statements that they submit to be on the nomination slate. And then we have invitations going out for members, and then recognizing that the cost of membership can be a barrier. We're trying to provide stipends and reimbursements for those conscientious objectors. That is one of the things that came out in our assessment, is that, you know, we can't just ask our members what they want. If we truly want to be inclusive, we need to ask our conscientious objectors and find out what it is that they need to have within our association to make it more inclusive and safe. Next slide, please. And then these are the priorities that our Racial Equity Committee has identified. Some of these are going to take a long time. Some of them we can continue. We've already started. So I talked a little bit about policy and advocacy. This is something that we really are trying to wrap our arms again around. We've started creating lists of partners and alliances that we could have. So trying to purposefully reach out and engage those organizations in our work. ongoing learning in education. So one of the exciting things that we're doing with our board is at every single meeting, someone is taking the lead on bringing forth either a piece of literature or a video and then having conversation about racial equity at the board level. And then again, intentional engagement. And then number 5 is probably the one that I'm most excited about because we've done it here at Vivint Health and I've seen the power that it can bring, is creating safe spaces for Black, Indigenous, and people of color within WPHA. So we haven't gotten there yet, but it's definitely something we want to do so that when folks do enter WPHA, they have a safe space to have true, honest conversation to talk about what are the needs, where are the challenges, and then bring forth those recommendations for the organization to consider. I think that is my last slide, and I am turning it over to Ella. Thank you.
Okay, thank you. So as one of the affiliate organizations of APHA, we are one of the leading professional associations for people dedicated promoting and protecting the health and environment of Michigan. And we are celebrating 100 years this year and have been working to improve the public's health through political advocacy, public awareness, professional development, and serving as an interface between research and practice. Next slide, please. As an affiliate and as a member of the affiliate, I love the fact that we're starting from within. We're asking ourselves some of those tough questions, looking at our organization and looking at its structure, looking at the diversity, looking at the gaps, and trying to understand how to address these issues. And we recognize from another presentation, I think during one of the APHA sessions that, you know, you even have to know how to ask the questions to get the information that we want, and recognizing that some of our materials don't go that far. So we're actually moving in that direction. Next slide, please. These are some of our legislative priorities: eliminating racial disparities, racism as a public health crisis, supporting COVID-19 pandemic public health funding, prevention and treatment initiatives, educating and influencing public health policies, and supporting policies and best practice for tobacco control and other addictive substances. Next slide, please. And here are some of the things that we're actually doing now. 4 members of our MPHA team comprise the Michigan Health Equity Team of the National Leadership Academy of Public Health, cohort number 10, fellowship program for 2021. And in that training, in that leadership program, we're addressing the social determinants of health identified in the CDC Healthy People 2030 initiative. We also intentionally include topics and speakers about health equity issues in our professional conferences, newsletters, communications, and publications. And we're collaborating with other partners and organizations and getting to know who's at the table and who they represent and how we can include some of the work that's happening back in our communities include that in the work of MPHA. Next slide, please. And sometimes it's as simple as just getting the ball rolling. So we had to add the discussion of racism and racial equity to the MPHA agenda. And oftentimes it's not something that just naturally happens because it's not an easy thing to do. But the one thing I've always pushed at the table is just getting started, just being willing to have those discussions, because I'm a firm believer that if we don't talk about issues, there's no way to work on solving the issues. We're talking now about, the racism is a public health crisis resolution introduced to the table. And now our MPHA board is looking at adopting a racism statement for MPHA. Next slide, please. So what I will acknowledge is that there are still probably more questions than there are answers, but I'm excited that we are a group who are willing to look for those answers and work on them. Next slide, please. And I will turn the mic over to Illinois.
Mark, I think you're muted.
Illinois.
Can you hear me now?
Yes, we can.
Okay. Hi, I'm Mark Stevens. I'm the affiliate representative to the Governing Council from Illinois. And in my day job, I am a regional health officer for the Illinois Department of Public Health. And what I'm going to try to do is give you an idea about what our association is doing and bring it up to relative terms, because we know during the pandemic, we've hit a lot of the issues on health equality and health equity in combating the pandemic. So a couple things, and next slide, please. And what I tried to do, I've just linked a few documents at the beginning that can all be found on our Illinois Public Health Association webpage. But some of the things that we've done is promoting Black History Month. And what we do is we support education and outreach during that time. Also have active social media messages on our page, and it includes links to racial equity relevant articles. What we did as an association, we were one of 179 organizations that were funded with the Healing Illinois grant. And basically what that did is we looked at communities that were very highly impacted by COVID, and we promoted dialogue, encouraged collaboration, and if I could read my scribbles, sorry, we facilitated learning through activities and started conversations and healing circles to restorative justice activities within Illinois, and we were glad to be part of that group that got funded. Next slide, please. Okay, getting a little bit towards pandemic equity. One of the things that we have done as an association, we were awarded a $9 million grant, Pandemic Navigator grant through our association. And what we've done, we've put community collaborators out in all areas of Illinois to help us reach those hard to reach populations. We didn't take the Field of Dreams stance where build it and they will come. Our stance is we're going to take our show to them. So what we found in early parts of this pandemic is that we had a lot of people that wanted the vaccine. Well, in Illinois now, we're down to the point where we think we've hit a lot of those people that wanted the vaccine early on. And so now our demand is slowing. That doesn't mean we don't have a lot of people out there that needs the vaccine. But what it does mean is we have to take our services to those populations. And those are, quite frankly, rural, hard to reach populations, which that is what we're doing with health equity. And one of the things that I'm actually working on through my IDPH and IPHA hats, we have communities down in my area. Roughly one health department covers basically the territory of the state of Connecticut. Now, I'm going to say a few things that might shock you. The health department has 5 nurses. So you can understand that they were kind of undermanned when it came to dealing with this pandemic, not to mention their counties rank in the county health rankings in Illinois near the bottom in everything. They have the 7-county area. They only have 3 hospitals, which are all critical access hospitals. They have counties with no gas stations. counties with no grocery stores, and it's just a really tight knit that won't cross borders to other counties. And one of the things that happened, we tried to take we thought we would do a big stand-up clinic in one of the counties down there, and then we sort of looked at everything, and it didn't pan out because they wouldn't cross county lines. Just because they're under the same health department, they're not crossing county lines. They're very territorial, and it is in the very southern part of the state. And as you can probably tell by my accent, I am far removed from Chicago. I'm at the very bottom part of the state, closer to Kentucky and Indiana, and connecting to Missouri. So we kind of go on our own, and we're kind of like fashion hits Chicago, and then about 2 years later, it kind of runs downhill to where we're at. So we're behind, and with the pandemic, our people didn't take it very seriously at the beginning, because all that will only happen where there's lots of people. But eventually it did come down to us, and now we are trying to reach out to those hesitant populations. And some of the things we're doing with our Navigator grants is we're putting together town hall meetings to address the questions that people have with vaccine and the importance of testing, why you need to follow the precautions that we prescribe as a state health department. And that's a little bit different. I know how we are. The quickest way to get me not to do something is tell me I have to do it. And we're all kind of like that. But we're slowly making progress. And what it has done is built a large collaborative network through lots of partners. We've had some very good efforts down in those counties with our migrant worker council came down from Chicago, helped us, and we did great. And down at our part of the state, we have a lot of orchards and vineyards that do bring in a lot of migrant workers, and we were very successful in vaccinating that population. We are fighting some hesitancy further on down south with populations of color, and we are having some difficulties, but we've got some great partners now, and I'm excited that my whole day has been meetings trying to strengthen those partnerships and reach out in a way that that we can get our message through. And we have to tailor our messages. What works in Chicago will not work where I'm from. That's one thing that is sometimes it's hard to get across. We're Illinois, but we're all different. And so those are some things that we're doing as an association in conjunction with IDPH. Let's see. Oh, health equity. I'm already on the next slide. Sorry. So what we've done in Illinois too, we a couple years ago passed health in all policies in Illinois. That each policy or legislation has to be screened for health impact. And in our mind, what we do is that means health equity. And so our association has been a very big advocate of health equity in all policies. And what we've done, we just finished our strategic plan this year, and we actually added greater awareness and targeted actions in our services as a public health association. And when I say that, I know a lot of associations don't do direct activities. In Illinois, we're a little bit different in that we do a lot of programming out of our association. And so we have about 25 employees at our association. And so we're doing a lot of direct. And so we've integrated health equity in our policies very stringently in our new program. We have appointed.
Hey, Mark.
Yeah.
Can I ask you to wrap up in about 30 seconds, because I want to make sure Joan has plenty of time to talk,
all right.
to give her. I'm sorry.
I sure will. But a couple of things we've done, we've appointed a health equity officer. We've reinforced IPHA health equity section to drive it more into where we need to go. And I've already talked about working with IDPH with hard to reach things. So that is kind of in a nutshell of what we're doing. So I'm going to turn it over to Joan from Indiana, my neighbor.
Thanks, Mark, and we'll move to the next slide. Thank you. I'm representing IPHA, Indiana Public Health Association. My name's Joan Trendell. I'm a retired public health professional who's worked for over 35 years in public health, most of my career here in Indiana. And I retired from the Marion County Public Health Department in 2019. So at this point, I'm representing APHA as the ARGC, but am also the president-elect this year. Back in 19, IPHA was going through a real change as we had turned over from our only executive director that we'd ever had for 20 years retired, and we went through a process of updating our strategic plan. And when we completed our mission statement, you can see that we included health equity in our mission statement. So that was primed to do that. We also have been really directing our work more at the upstream work to try to have more impact on the social determinants of health. And that's where we're headed now with the work of IPHA. And for the next slide, we'll see that we have the Indiana Health Equity Action Team. That's acronym is HEAT. And this is the group that represents the work that we're doing in the area of health equity. It's a collaborative group, and we've had probably over 70 people that have signed on to receive information and join the meetings. It represents a variety of organizations. It has local and state public health folks. It has folks from the not-for-profit sector, from academia is represented there. And we are joining together to work to build awareness, understanding, capacity, and our state's ability to address health equity. Next slide, please. The work of our health equity team is guided through the definition of health equity, which we saw a little bit earlier in a slide, I believe, that Ella had, that the definition that Robert Wood Johnson Foundation uses. And as you can see, it focuses much on those upstream social determinant of health issues that in the end are going to impact health equity. Next slide. Some of you may have seen this slide in the past. I can remember seeing it at an APHA meeting many moons ago. So the work has been out there for some time. This is from the Bay Area of California. And this again is a depiction of where we need to go with our public health framework for reducing health inequities and looking at the social inequities, the institutional inequities, and the living conditions that are impacting the health of our populations. And that work is in the area of policy. That's where we really have to direct this work in order to see the changes. And the work that we're striving to do will keep this framework in mind as we move forward. Next slide, please. As a group, we have monthly meetings, and the group's been meeting on Zoom this year, of course. We share information and resources among each other. Great way for networking to happen and to identify collaborations and aligning resources together. And we have worked to organize educational training and training opportunities. I was able to attend the meeting recently, and it was the day after the verdict had come out of Minnesota. And I was really taken by the facilitators of that meeting, giving time for people to process what they were feeling and thinking in light of the news that had just come out. And it really was a safe place for people to share their thoughts, their feelings, and their ideas for moving forward. Next slide, please. Our participants really know that advancing health equity is going to be the key for success, and that the foundation element, as we've heard today from some of our other states, is that health in all policies really has to be the approach that we take when trying to move the issues around racial and health equity. We're working together to facilitate initiatives and policies in communities throughout the state, and we do have good representation from various areas of the state. At the meeting last week, there was great connection made so that some of the work that's being done for outreach for vaccine hesitancy up in the Gary area was talked about, and some connections were made for that work. So it's a good way for participants to find out what's happening around the state and to hook together to share resources and ideas. Next slide, please. We had a health equity summit that we sponsored back in August of 2019. We had over 200 registrants there, and we had the work of Lily Farhang with the Human Impacts Project. And if you're not familiar with them, that's a really good resource to see in terms of some of the work that's happening through them. And as a group, our Great Lakes Public Health Coalition last week for our mid-year meeting had a session that she facilitated for leaders in our 6 state affiliates to listen to and to have small group discussion in our states about moving forward in the work that we're talking about today. We hope to have another summit either late this year or early next year. Next slide, please. In 2021, we are prioritizing the work that we want to help influence and push on the public health crisis, racism as a public health crisis declaration that was made here in Marion County, which is the capital of the state. It's Indianapolis. And so the work of HEAT will be seeing how they can work to prioritize and influence that declaration as we move forward. And we're planning and identifying action steps that can actually operationalize the commitment and set a model for other areas of the state who are considering or need to go in the direction of this work of declaring racism as a public health crisis and to have action steps from that work. Next slide. There we go. At this point, I'm going to circle back to Erica to kind of end the session for us. Thank you for your attention. Erica.
Thank you, everybody, for participating in this and presenting on the work of your states. It's really, to me, it's really nice to hear the great work that everybody's doing and for us to be able to share among ourselves and learn from each other. So unfortunately, we are at the end of our time and don't have time for questions, but this is our contact information. So you're welcome to email any of us to have your questions answered. I know one of them that Jaime had asked was about what people are doing to build leadership. The next step in this conference, there's also some networking breakout rooms, and I'll go into one of those breakout rooms. I don't know if anybody else from Great Lakes can stay. We could go into a breakout room if people want to ask us questions there for a few minutes. That's one way to address it. So the next slide is just thanking everybody for participating on the panel, and we appreciate the opportunity to be able to share our ideas with you. So thank you. And then I think, does it go back to Liz?
Yes, it comes back to
Actually,
me.
could I say something really quick?
Yes, Kelly.
It's in the chat, but I gave the wrong website for OPHA. So unless you have a specific interest in the Ohio Paint Horse Association, OPHA's website is ohiopha.org, not opha.org. Thank you.